it's Dr. Julie Gray with Piton Physical Therapy here on day 4, question 4 of the big 7 questions about vestibular therapy. So today's question is, how are vestibular conditions diagnosed? So there are many different types of vestibular diagnoses that you may have heard of, like benign paroxysmal positional vertigo, vestibular neuritis, vestibular labyrinthitis, acoustic neuroma, vestibular migraine, vestibulopathy, post-concussion syndrome. And I don't know about you, but just hearing all of those names are making my head spin, no pun intended. So these all have very fancy names and sometimes can be really intimidating. And some clients who start to develop dizziness or vertigo will go to the emergency room and they'll get tests that include an MRI or a CT scan of their brain. The purpose of this test is to rule out any big and scary pathology, like a tumor or a stroke. Once these conditions are ruled out, clients may feel frustrated, not having solutions to their symptoms and being told that they have vertigo. I am here to tell you that vertigo is a symptom. It is not a diagnosis. That would be similar to seeing someone for a shoulder condition and your provider says your diagnosis is pain. You really wouldn't accept that for an answer, and you would seek out a provider with more expertise in your condition, and that's where we can help. Some people get referred to an audiologist for special vestibular testing. These tests can be called a VEMP or also a VNG. VEMP test measures the reflex between part of your inner ear and the muscles of your neck, which can be helpful in providing information about the integrity of this reflex. It provides information about the health of the inner ear and its neurologic function. However, VNG uses infrared video camera to record eye movement. The eyes are a gateway to the function of the inner ear through their nerves. This can be extensive and can include caloric testing, which helps to measure the responsiveness of the horizontal canal, and it involves getting hot or cold air or water pushed into your ear. In our physical therapy clinic, we assess all the components of your balance systems: your eyes, your inner ear, and your joint sense. We'll screen the quality of your eye motion for tracking, converging, then also performing different series of balance exercises on multiple different types of surfaces with different conditions, like eyes open and closed. We'll also assess your cervical mobility, that's in your neck. And we look closely at the health and the function of the vestibular system. Now, we perform this through a different series of tests, but also similar to a VNG, we get help by using infrared goggles, which helps us track and record eye motion, and it gives us information about the health and function of your vestibular system. Many of my clients feel frustrated as they arrive to therapy without a diagnosis and an MRI that maybe indicated that everything was normal. However, this does not mean you're not having symptoms. So you might be asking yourself, can I start vestibular therapy without having a diagnosis? If you're someone who's experiencing symptoms that sounds like they could have a vestibular component or be struggling to get a diagnosis for your vestibular dysfunction, that does not mean that vestibular therapy can't start to be effective now. Take, for example, somebody with shoulder pain. We may suspect for a rotator cuff strain, however, we don't need to wait for the imaging and other corroborative findings to start therapy to build up the strength in the shoulder. In the same way, if there is a weakness in your vestibular system, we're able to start strengthening it while helping you navigate getting to the proper resources and referrals if you need them. In New Jersey, where I practice, we have direct access, which means that you can see a physical therapist without a prescription from your physician. Of course, if we find anything during your testing that is alarming or requires a referral, we will help explain to you what we believe is going on and help you connect with the right providers. So that's a wrap on day 4 on our 7-day journey talking about vestibular therapy. Next up, we'll take a deeper look and learn what is assessed in vestibular therapy. Thanks, guys.